Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Okay guys, today I'm back with the answers to case 9 and the 5 multiple choice questions that I asked you on yesterday. So let's get started. First with our case 9. Case 9 was a skilled nursing facility visit. Gave you a face sheet, described the age of a 70-year-old female. She has Medicare. Again, she's in a skilled nursing facility. This is a follow-up visit. She was admitted to this nursing home 10 days ago with cellulitis of the left foot. Hint, hint. She was placed at Elm Croft for IV therapy of her cellulitis. She's recovering well. Infection is almost gone. She does have a history of type 1 diabetes. Let me stress this. I was asked a question about why are you coding history for some conditions and not others? Remember the rule of thumb. With those history conditions, if they need treatment today while the patient is in this case, she's in a skilled nursing facility, has been here 10 days. She is on insulin for her type 1 diabetes and the IV vancomycin for the cellulitis. So because they have to treat her for this history of condition, then that justifies us coding. So again, if these other conditions, these comorbidities that your patient has, and if they have to treat it, then you code it. If it has no bearing on the admission, you don't code it. Okay, going on in, it gives you a little bit about the physical exam. But again, this history is problem focused, all about the problem. Exam is problem focused. Medical decision making is straightforward. It's all about the cellulitis of the foot. So if you code cellulitis of the foot, you get, L 03.116, identifying the left lower limb. Again, this patient also has type 1 diabetes, of which she takes insulin. And remember the rule of thumb with insulin, normally if it was a type 2 diabetic who can take oral medication or diet, and if they are on insulin, we use that insulin, long-term use of insulin. But for type 1 diabetes, it's understood. Their pancreas is not producing insulin. Therefore, they're automatically going to be on insulin. We don't have to use that additional code for long-term use of insulin. And then for the nursing home visit, again, this is a follow-up visit, so it's a subsequent nursing home visit, 99307. All right, guys, how did you do? Okay, this was a pretty straightforward case. Also, I gave you some multiple choice questions. First one says, a patient is diagnosed with congestive heart failure. A drug of choice for congestive heart failure, digoxin. Okay. 2, Jane Doe was admitted to the ambulatory care unit of the hospital for a planned cholecystectomy for cholelithiasis, but shortly before surgery, Jane developed tachycardia, and the surgery was canceled. After a thorough workup for the tachycardia, Jane was discharged. The outpatient admission should be coded in the following sequence. Whatever justified admission of the patient to the hospital, even if after she comes in is canceled, that is still the principal diagnosis. So in this case, she was admitted for cholelithiasis. So it's the cholelithiasis. She developed tachycardia, which caused the surgery to be canceled. So D is your answer. All right. 3, a service provided by a physician whose opinion or advice regarding evaluation and or management of a specific problem is requested by another physician is referred to as, and remember we discussed this earlier in one of the previous cases, it's a consultation. It's a consultation when one physician asks another physician's opinion for how the first physician should treat a condition. And that the one that I'm asking opinion on will notify me back in writing. I write to him an order. He writes back and lets me know how to take care of it. That's a consultation. All right. 4, Don Smith is a status post mastectomy 6 weeks ago. due to carcinoma of the breast. She is admitted to the outpatient clinic for chemotherapy. What is the correct sequencing of the codes? So what is she coming in for? She's coming in for chemotherapy. So I would code the chemotherapy first. And because she's still receiving active treatment for carcinoma of the breast, then I would code chemotherapy and malignant neoplasm of the breast, because that's what she's coming in for. I realized she had the mastectomy 6 weeks ago, but she's still receiving the chemotherapy. So it's still as if that is the condition. Now, if it was a personal history, that means that situation's already been resolved. Well, here is not. She's still receiving chemotherapy. So the reason she's coming in, chemotherapy. The next diagnosis is the malignant neoplasm of the breast. All right. And number 5, patients admitted in alcohol withdrawal suffering from DTs. The patient is a chronic alcoholic and cocaine addict. Which of the following is the principal diagnosis? All right. They said she's going through alcohol withdrawal. She's suffers from chronic alcoholism. She is addicted to cocaine, so she's cocaine dependent. And today she's suffering from delirium tremens. So that becomes the principal diagnosis, because that is the reason after study that she's being admitted to the hospital. She's being admitted. She's in alcohol withdrawal, but she's suffering from DTs. So DTs becomes your principal diagnosis. All right, guys, how did you do? Okay, I'm going to challenge you one more time. I have another case that I want to make sure I give you for the weekend so that you can stay in your books. All right. This case, long case. Here's the inpatient face sheet. Susan Kendall. Let me enlarge this so that you guys can see this. This is just the face sheet. Her name is Susan Kendall. Admitted 2-3, discharged 2-8. Female, 62 years old. She went home upon discharge. Her admitting diagnosis is abdominal pain and hypertension, but her discharge diagnosis is acute and chronic cholecystitis and cholelithiasis. She has hypertension, she has hypokalemia, and she has a urinary tract infection with E. coli. She did have a procedure done, a laparoscopic cholecystectomy. So here's your discharge summary. And I'm not going to read it because I don't want to lead you with the coding. I want you to figure out what the coding is correctly for this case. But this is the discharge summary. There's the hospital case. Look at all this lab. Chest x-ray, hemoglobin hematograph. Pause the video as you need to. That was the discharge summary. Here's the history and physical. Review of systems. Laboratory data. Here's your procedure note, because remember, she did have a laparoscopic cholecystectomy. She did have a path report because the gallbladder was removed. And here are your daily progress notes. So you actually got a full medical record other than nursing notes, MARs, any other therapies, but you have the full physician medical record for an inpatient stay. There's an example of SOAP notes: subjective, objective, assessment, plan. So see how subjectively the patient's complaining of abdominal pain and decreased appetite. But objectively is where your physician brings in labs, because these are just nothing to be disputed. It's not his opinion or the patient's opinion. These are lab results. So his assessment, what he's assuming it is, and then the plan. So that was day 4 to 5. Day 6. Day 7. And on the 8th day, no complaints, vitals stable, bowels sounds are present, ready for discharge, discharge home. And here are the orders. Day 1, they admitted the patient on the 3rd. 4th, they prepped them. 5th, repeated the labs. 6th, and then on the 8th, we're discharged home. So if you were to code this case, you've got all the physician documentation here. I'm looking for diagnoses, and ICD-10 CM diagnoses and CPT procedures. I know this is a hospital chart, it would be PCS, but I don't do PCS coding. And in my hospital, I worked in a hospital, this is how our medical record was put together. We had the face sheet on the top, and then we had the discharge summary next. It's the summary of the stay. I had a subscriber ask me, what are some of the common forms in a medical record? Well, these are what they are. You have your face sheet, which is really your demographics on your patient. Gives the admitting and discharge diagnoses, any procedures. Then you have a discharge summary. All of these forms are done by the physician, and as coders, we only code what physicians document. The other documentation, nursing, etc., assists, but we code based on physician documentation. So in discharge summary, you have your admission and discharge date. It's a summary of the hospital stay. History and physical is done on the day of admission, so this should be the first report you see. There's your lab data, assessment, plan. This could be procedure note or operative note, however you refer to it at your facility. And anytime a body part is removed, remember it goes to pathology. There's your path report. Daily progress note. If patients in acute care, there should be daily progress note. Subacute once every 3 days. Long-term care every 30 days. There should be physician documentation. There's the orders. All right. Now, I did have some multiple choice questions for you. Now, today I'm going a little more into the billing world. The blank is a statement sent to a provider to explain payments made by a third-party payer. 2, the computer-to-computer transfer of data between provider and third-party payers in a data format agreed upon by both parties is called. 3, the blank refers to a statement sent to the patient to show how much the provider billed, how much Medicare reimbursed the provider, and what the patient must pay the provider. 4, the term used to indicate that the service or procedure is reasonable and necessary for the diagnosis or treatment of an illness or injury consistent with generally accepted standards of care is. And number 5, the Correct Coding Initiative, CCI edits, contain a listing of codes under 2 columns titled Comprehensive Codes and Components Codes. According to the CCI edits, when a provider bills Medicare for a procedure that appears in both columns for the same beneficiary on the same date of service, do you code only the component code? Do you not code either one? Code only the comprehensive code? Or code both the comprehensive code and the component? Okay, guys, pause this video as you read through these questions and answer the multiple choice question. Choose which letter corresponds to the answer that you want to choose. Okay, guys, that's it. I will see you on Monday with the answers to these questions. Thanks, guys.